Hello, today's video topic is umbilical hernia. Umbilical hernia is a type of hernia that happens in the navel region. Our navel region is the weakest part of the body, especially weakest part of the abdominal wall. When the baby is inside the mother's uterus, it is connected to the mother through the umbilical cord. When the baby comes out, the umbilical cord is clamped and it's cut. And when it heals, usually the umbilical cord falls off and the defect is closed. But some people, it remains open, and it can be even it may take 3 months to heal. So that is why some of the children, they will have a swelling up to 3 months, 5 months. Then naturally after that it heals off, it closes off. That is why in village and all, the treatment for that, what they do is they keep a coin and they tie it, they close it. So naturally they're promoting the healing. So naturally it heals. Umbilical hernia, the signs, usually the child is born for up to 5 months, 6 months, the umbilical hernia, if a bulge is there, it is very normal, it's accepted one. But after that, if it remains there, it's called umbilical hernia and it needs little attention. And usually the signs are, as usual, there will be a swelling which can be evident when a child cries or when the child pushes for motion or urine. You can see the bulge and they may have a pain. This umbilical hernia even can happen in the adults. Usually for the adults it happens, for the females happens after the pregnancy. So when the pregnant lady, when the baby grows, the pressure inside the abdomen increases and it can create a defect, or it can open up the umbilicus or the navel region. So hernia can happen, especially if it happens with the repeated pregnancies, or the patient, if a person is so obese, if they gain weight because of the too much of fat, the umbilical region or the navel region opens up, forming a umbilical hernia. So umbilical hernia is a defect. So if there is a defect, like any other hernia, as we always say, if there is a defect, it has to be sutured. There is no other treatment options available. Umbilical hernia usually happens either in the childhood or after pregnancy, or even the very old people or obese people. And how to treat hernia or how to take precautions, as you should have with any other hernia, we always say avoid any intra-abdominal pressure, like pushing for motion, pushing for urine, asthma, bend, heavy work, weightlifting, all these things to be avoided. So that the surgery is the only option. It's always preferably it's done by laparoscopically, and mesh is the best thing. Hernioplasty, that is using the mesh, close the defect. And sometimes if the hernia is so defect or is complicated, like the intestines get caught or incarcerated or obstruction or even gangrene happens, then conventional open surgery is the preferred one. And most of the time, if it's a gangrene or infected one, the mesh is usually not kept. Only hernia raphe, there is only suturing is done. And how to avoid umbilical hernia, like any other hernia, avoid constipation, difficulty in urination, prostate problem, asthma, wheezing, weight gain, and heavy weight lifting. All these things should be avoided. And for children up to 6 months or 3 months, any swelling or any hernia in the umbilical region is allowed. But if it remains more than 6 months, it needs attention, and before 4th year or 5th year, it needs to be operated. Thank you.